I Hate Politics is a podcast about a human activity we love to hate. And this is the I Hate Politics candidate interview with Terri Hill for Congress in Maryland's 3rd District. I'm Sunil Dasgupta, host of I Hate Politics, a podcast about our neighborhoods, workplaces, schools, and streets, and our local governments as they function in diverse, democratic, and sometimes divided societies. As part of the show, we have conversations with local, state, and sometimes federal candidates. Rather than ask how they stand on a multitude of issues, these conversations go in depth on a few issues and reveal the character of the candidates. Mail-in ballots for the upcoming May 14th primary are out. Early voting starts May 2nd. There are 3 congressional districts in Maryland where incumbents are not running. District 2 up by Baltimore, District 3 that centers around Howard and Anne Arundel County, and District 6, which starts in Montgomery and goes all the way to the mountains of western Maryland. The primary election in Maryland's 3rd District has a crowded field. Among the leading candidates is Terri Hill, a physician and a state delegate from Howard County. You can find interviews with other candidates in the I Hate Politics library, available on all major streaming platforms. Music for this episode are 2 short piano pieces from Kensington resident Adam Bobrow. If you want to share your music on the show or know someone else who might want to, please email us at producer@ihppod.org. Terri Hill, welcome to I Hate Politics.
It's good. It's good to be there, although I guess I should say I hate being here.
Oh, good to know. You wanted to talk about healthcare as a candidate in Maryland's 3rd District. What is the scope and size of the problem you want to tackle?
One of the top issues right now is what the heck is going on with reproductive rights, right? So the courts have decided that this is a state issue. The states have decided that they want to make it a federal issue. We in Maryland have done, I think, a pretty good job of making sure that we are protecting reproductive choices and the option of receiving the full range of reproductive services here in the state. And I'm actually proud to have been the sponsor of one of the key pieces of legislation that was passed in 2023 in that 4 bill package that includes the constitutional amendment that the speaker led on, and that will be on referendum in the ballot in November. It included digital data protections. It included making sure that at our colleges and universities, there are free and available birth control and other methods to prevent pregnancy and adequate counseling around pregnancy. And the bill that I introduced along with Delegate Nicole Williams was the one that said that if you are either providing abortion services, guiding people, or counseling them about abortion services, or receiving abortion services here in Maryland legally, that we will not participate or cooperate with other states that may be trying to subpoena medical records or other information in order to prosecute you either civilly or criminally for a crime that they consider a crime in their state. So essentially, if it's legal in Maryland, we are not going to help other states to treat it as if it's illegal. And so that's a great protection. But even with all those 4 and the other things that we're doing this year, it only takes a bill from the federal government to take it all away. And just as many people did not understand with the election in 2016, how close and how fragile reproductive rights were. And again, reproductive rights are not just about women and abortion, right? They're about the state's role in what are ultimately very personal decisions between physicians and other healthcare providers and their patients, and whoever else the patient chooses to bring into that conversation. And if you think about it broadly, the government has no idea what any particular person's medical history is, what the nuances of their social situation are, what their underlying health. They're not in that consultation room, nor do they have the training and skill to be making these decisions. So when we have allowed, or we stood by knowing for the last 50 years that there was an effort to get the Supreme Court to overturn Roe v. Wade, and we did not understand the significance, or enough people did not understand the significance of that election, and put someone in the presidency who made it clear that one of the things he was going to do was make sure that he put justices in place that would overturn Roe, then it tells me that they don't understand that it is more than about abortion.
In Maryland District 3, you are running right now in the primary against other Democrats who are all very strong proponents of abortion rights, including Senator Clarence Lamb, who is himself a physician.
In this next election, where we expect the margins in the House and the Senate to stay narrow, okay, it will only take a vote or two. So what we need are people who not only are on the side of reproductive rights, but have lived experience, which frankly, of the major candidates, I could say only two of us do. We have allies in the race. We have two women who are actually in this lane, right? So we're more than just allies, okay? The difference between Dr. Lamb and me is that although he does some employee health clinical work, he is primarily, most of his career, been a public health doctor. That's important. That's an important lens. But I've been doing clinical medicine for over 30 years, including taking care of women before and after abortions, including taking care of patients who are gender nonconforming, including...
But let me ask you this. Mm-hmm. Do you think an elected representative needs to have that deep knowledge? Should we expect, for example, every member of Congress to have served in the military before they can make a decision to go to war or not?
No, but I would say this. I say when 19 members of Congress are physicians, and many of them are retiring, and of those 19, 4 are Democrats, 3 are women, and none of them are Black women or Black. So we've got some brown folks. There's a woman who is, I think, a Latina. Okay. And when we're talking about the history of using the uterus for controlling power, which for me as an African-American woman goes back to slavery and has continued on. And when some of the arguments for choice and the arguments against choice have to do with claims that it is a racist, that abortions are racist. And when we know that poor women and Black women, having access to choice about their own health and how they grow their own families is important. When we're talking about courts determining as of late that a 4-cell embryo has all the rights of you and I as we walk upon this earth, that's a problem. And it really does take voices of people like physicians who can speak to the absurdity of those assumptions. We're living in a time when people continue to think there is such a thing as alternative facts. There are no alternative facts. Alternative facts are lies. And it is important that we have people who are willing to speak to that, okay, and can speak it with authority. So I know how my position as a practicing physician how it weighs not just on healthcare issues in the General Assembly, but on other issues, whether we're talking about, behavioral health, when we're talking about, when I said I look at everything as a healthcare issue, when we talk about environmental issues, those are ultimately healthcare issues, right? We're talking about the quality of your water. We're talking about lead. We're talking about air. We're talking about cumulative pollution in primarily brown and Black communities and poor communities, and what those effects are.
If everything is healthcare, then why have a different Department of Energy or Environment? Or
because everything can be viewed substantively through a healthcare lens doesn't mean there aren't other components and other perspectives that have to be included. But what we need are people who can speak with authority about what the damages are. Some people in Congress, particularly on the Republican side, and I'll call it the Republican side because I know that my constituents are tired of us not calling it out for what it is. They are playing with policy as if it's a parlor game, when for my constituents, it's life and death many times. Okay? So when they're playing with issues such as, again, in the healthcare field, prescription drug costs, okay? That's life and death. And I'm really proud that one of the things that I did do, and you can talk to Vinnie DeMarco about this, it was my perspective as a practicing physician that put the amendment on the physician drug affordability bill that got it to pass constitutional muster. So you'll remember that the previous session, we had passed a bill that didn't pass constitutional muster. But it was when I called Vinnie and spoke to Delegate Pena Melnick, who was not chair at the time, but she carried that bill. And I said, we just went through that hearing. The drug industry is right. This won't pass muster because we're trying to tell them what they can charge in our state. We can't do that. But what we can do is what Medicare already does with us. They do not tell me as a physician what I can charge. They tell me what they're willing to pay. So we can tell them what we as a state, with our state plan and the plans that buy into it, and with Medicaid, what we're willing to pay. They can charge whatever they want. We can't tell private industry what the ceiling is on what they can pay for drugs, but it should work the way Medicare pricing has worked in the medical market. Once they set the limit, the insurance companies will fight to the bottom to get as close to Medicare rates as possible. So we don't have to control what insurance is willing to pay. All we have to do is say what we'll pay. And that was the change that got us moving on this board, whose recommendations would come out. That's the kind of perspective that becomes helpful. The same kind of thing when we're talking about education. It is more expedient to say we're going to invest in keeping kids, who've been arrested out of going into prison or going into the juvenile system. That's important. But what did we do up front before they did the things that got them caught up in the system? $100 pair of glasses might save us a few $1,000s down the road, but it takes more effort to convince people. And if we can't find that money, then we're investing in it down the road. We're going to be paying for this one way or the other.
Solid logic. How do you do it?
You do it by continuing to fight for the things and to make the arguments. And sometimes it takes a while for the arguments to be understood. But I'll give you another example. We have systems that are designed to determine which people in our criminal justice system are likely to reoffend. And that has some weight in determining whether people gain parole or don't gain parole, what programs they get, all that kind of stuff. Some of the, as I understand it, some of the evaluations are based on something that's called the psychopathy exam, which the guy who invented it said that's not what it was meant to be used for, and that it's a misuse of the tool. But we're using the tool anyway. All right. So it may well be that the advice is that there are other systems, there are AI programs that are better, but when the AI program we want to use, we want to look at not just the biases in the system that the developer is aware of, but we want to look at how it also looks not just at race, maybe how it looks at gender, that we want to make sure that the information we put in is protected. It could be that when we say that it's okay in the state for merchants to use biometric data to determine who gets into their store, whereas we're seeing in some their jewelry stores and other places where you have to be allowed in by biometric data, but we don't have clear rules about who that data belongs to.
These are very context-specific systems. This is not some kind of universal.
So that's where I think you're wrong. There are some global parameters and there are some ways of engaging with AI that can be applied to all of those things. Talking with the experts, they are saying there's some clear best practices that we need to be incorporated. They can also tell us what's the next innovation coming down the road.
Okay, so have they come up with best practices or they are working
We're setting up this commission. That's what the bill does. It sets up the commission so that we can have best practices that are not onerous. It includes, again, not just the professors from UMBC and professors from Morgan, the Applied Physics Lab, Hilltop, University of Maryland, HBC. It also includes private industry, the folks who are in the field and offering. It includes representatives from a range of groups. And the way the commission we anticipate it working, there will be subgroups to suss out exactly what you're talking about. Well, what does this mean for, life insurance? And do we need to change our policies about that? And is it fair to use AI algorithms in assessing that? Is it not fair?
But I think that question is water under the bridge. I mean, you're not going to tell life insurance companies that they can or cannot use it. If they feel like they can, they will.
Again, I'll disagree with you. We have a bill right now that is talking about whether we should forbid insurance companies from using genetic tests in determining what your risks are and what your premium should be.
Are the people in Maryland's 3rd District going to be moved by arguments about the uncertainties of AI to vote for you?
I think what they will appreciate is that part of what I bring is a more integrated view of how all our problems go together, that you can't talk about root causes if you don't understand what the big picture is. I tend to be a person who likes to follow the threads back to the common cloth. I don't think we're talking about separate issues. I think that many of the things that we're dealing with all interact together. And that's talking about, the problems we have as a state, the problems we're dealing with as a nation. And too many times we try to deal with things in isolation. And it becomes really important to have people who are going, but this really is impacting this piece over here.
You made this case about being comprehensive, integrative, looking at the whole picture rather than isolated. There's a balance between those two. Sometimes if you go too much into the integrating approaches, you bite off too much and you can't chew. You've made a solid case for integrating these kind of silos. But also the silos are not, completely meaningless. There's a reason why those silos exist.
What I'm speaking to is your initial question is what is it in this field of 22 of Democrats that I uniquely bring? Okay. You asked what differentiates me. And I'm saying that in addition to being the only Black woman in there, so for people who think that representation matters, right? People who think that not only is reproductive choice on the table, and that therefore would be good, and particularly in an all-male Maryland delegation, right? People who talk about that, including men who say, yeah, we need to have more women in there, who are not looking at the 4 women who are in this race, or 5 women, I think there may be more than that, and or whatever you talk about, the first tier, second tier, and not taking a serious look and saying, you know what, all else being equal, you said we have so many similarities. Okay, well, all else being equal, that should limit the field from 22 down to a much smaller number. And now you're talking about what else do we bring?
So part of the problem is that voters don't pay that much attention as you would like them to pay. You are a veritable expert on a variety of things. But a lot of voters, they are not paying attention to the kinds of things you're talking about. When 22 Democrats run, or 15 Democrats, or even 7 Democrats run, it is very hard to distinguish between them because programmatically, they look very similar.
That's the challenge of any race, right? So when I ran in the special election in District 7 when Howard County was part of Congressional 7 4 years ago, the special election primary, which was like a 7-8 week race between the time when Elijah Cummings died and when the race was held. 28 candidates. And, I didn't do bad. I came in fourth, right? And I won Howard County. Okay, so I'm the only candidate other than Congressman Kwesi Mfume who won a district. And that is Howard County, where, again, I represented a small part of the district. But the Democrats in Howard County felt strongly enough about how I had performed for them as an elected representative that they chose me to be the person that they wanted to send to Congress. So they didn't choose Kwesi. It was a small margin. They didn't choose Maya Cummings, the widow. They didn't choose Jill Carter, a senator who was well respected and well known, particularly as a progressive leader. Okay, and that was meaningful. So I do know that it's not just the platform; it's the work. It's the work that I've done. It's the things that I've been present for. It's my record. Okay, so you're right. If all campaigns come down to how do you get the voters to hear your message? All campaigns go to how frequently someone sees your name, so that when they look at a ballot, that name looks familiar to them. Right? You're correct. I also think, like I think many of the other folks in the race, although some think it's not that big a deal, that this really is a critical moment. We've been hearing for 5, 6, 7 races now that this is the most important election of our lifetime. And it's been true every time. And it's true again now. I'm not convinced that if we don't push back against the forces that frankly are trying to take us back 150 years to undo all the work on multiple fronts, to actually have us go back to a time when we're not going to be able to even teach history unless it's been vetted by a narrow group of people. We talk about the broadening wealth gap and the pushing in more and more wealth to the 1% and even the 2%. And I have very wealthy constituents who are asking me at meetings, what are you guys doing about that? Because they understand, A, that it's not right, and B, that it's not sustainable. Okay. So people understand those things, and they want to know that someone they send has the breadth to be able to address those, has the passion to be able to stand up to the lies, as I mentioned earlier, that are coming out and not allow them to stand. There are many people in the constituency in District 3 who believe that the Democrats have been too passive. They've let too much go unchallenged. And that's why, you talk about Congressman Jamie Raskin, and I call them, the young mavericks that he has serving on his committee. They appreciate the fact that when a Marjorie Taylor Greene or a Lauren Boebert or a Matt Gaetz says something that's just, ridiculous on the face of it, that it's not just being allowed to stand unchallenged, because what we do know is that a lie repeated often enough begins to sound like the truth.
And you would be a more effective counter against the Marjorie Taylor Greenes and Lauren Boeberts of the world than the other Democrats running against
And
you.
what I'm bringing in my lived experiences, I'm exactly at the juncture where these attacks are coming. Okay. So it's one thing to talk about somebody else's experience, right? And trying to find someone else. It's very different when you're looking someone in the eye, trying to tell them who they are. I've said this publicly before. Most of the problems we're dealing with, certainly here in America, and I believe in the world, are not because of failed policy. They're actually because of policies that have succeeded beyond measure. We don't have poor people because of failed policy. We have poor people because we've had policies designed to keep some people poor. We don't have uneducated people because we had failed policies. Our policies were designed to make sure that certain people stayed uneducated. We have a high rate of criminal infractions and incarceration because our policies were designed to criminalize behaviors and to criminalize certain communities. So we have the outcomes that our policies were designed to create. So if we want different outcomes, we need more and different policies, more intentional and different policies.
Terri Hill, thank you for taking the time. Good luck in the campaign.
Thank you very much.
That's Maryland State Delegate Terri Hill, who is running for Congress in Maryland's 3rd District, which centers on Howard and Anne Arundel counties. You can find her at terrihill.org. Music for this episode comes from Kensington resident Adam Bobrow. If you want to share your music on the show or know someone else who might want to, please email us at producer@ihbpod.org. I hope you'll listen, like, and share the show as we bring you stories about politics close to you and to your home. Mail-in ballots are out. Early voting starts May 2nd. Primary day is May 14th. See you next time.